Shall I share my content?
Yes, sir. Just a minute. We will just have an introduction and we can go ahead, sir.
Okay, fine.
Good evening, one and all. Welcome all to Vayomanasa Sanjeevani's webinar series. Today's topic for the day is World Cancer Day 2022, and the theme is close the care gap. Everyone deserves access to cancer care. So, as we are celebrating February 4th as World Cancer Day, we thought that we'll have a session on the Cancer Day. So we have our resource person, Dr. Murli Subramanian, sir. Welcome, sir, for today's session. And our moderator for the day is Mrs. Shakuntala Narendra. She is a lay counselor and a Vayomanasa Sanjeevani volunteer. I welcome you, ma'am, for today's session. With that, I welcome all the Zoom and YouTube participants for today's session. Now, I request Shakuntala, ma'am, to introduce our speaker. And on to you, ma'am. Thank you.
Thank you, Gina. Thank you. Hi, good afternoon, everyone. It is indeed a pleasure to introduce the resource person of the day, Dr. Murli Subramanian. Dr. Murli completed his MBBS from KMC Hubli and his MD in General Medicine from Srimati NHL Medical College, Ahmedabad. Post-MD, it is DM in Medical Oncology from BJ Medical College, Ahmedabad. Upon completion of his DM, Dr. joined as a faculty in the prestigious MS Ramaiah Medical College and went on to serve as a professor in the Department of Medical Oncology. Dr. Murli is currently the Medical Director of Daycare Center at SCG Bangalore. His recognitions are many. To name some, Dr. Murli is the pioneer and has been instrumental in setting up the first dedicated daycare chemo infusion center in Bangalore, and he has also received the coveted GCRI award for outstanding academic achievements in 2005. Doctor also has published many articles in national and international journals. This is a very brief introduction, sir. So it's really a privilege to have you on this virtual session. Welcome you, sir. Over to you.
Thank you, Mr. Shakuntala, for that kind introduction. Without any further delay, I'll just start sharing my screen. Let me know. Are you able to see the slide?
No, sir, we have not.
Now we can see. Yes, sir.
Yes, sir.
All right. Okay. This month of February 4th, is World Cancer Day, and access to cancer care for everyone. The gap has to be filled. Although there are many challenges in that, I think what is under control is being aware. Being aware is the most important thing. That's the most powerful tool what we have. Being aware of one's risk of cancer, what as an individual one has to do from a lifestyle point of view. Does one need to worry about the genetic risk? So all these are factors which are under our control. And definitely once a diagnosis is made, there's a lot of things which is not under our control as far as the access is concerned. So I'll briefly also touch upon the access to cancer care, how it has changed. But primarily this talk will be giving awareness to the general public. Am I audible?
Yes, sir. We can hear you.
This is the first slide. This is the cartoon which I've kept it very simple so that the general public can clearly understand what we are dealing with, what is a cancer, what causes cancer, and are there any tests which can be done to screen cancer? Which are those cancers? Can all cancer be screened? These are some of the basic things which I will be touching upon. So normally also the cells in the body, they keep dividing. So, but there's an information given to these cells that you need to stop at this point of time. But in an abnormal cell or a cancer cell, this control is lost and they continue to divide abnormally. So that's the basic difference between how a normal cell divides and how an abnormal or a cancer cell divides. This cartoon shows features of a cancer cell. Basically, it has two important features. One is the ability to form a tumor or a lump so that it has a capacity to spread to the surrounding area, not just spread, has a capacity to destroy those tissues as it is spreading to the surrounding areas. And not just that, once it gets into the bloodstream, right at the bottom of the cartoon, you're seeing these cancer cells can spread to distant parts of the body. For example, a cancer or a lump or a tumor can be there in the breast, but its impact can be seen on lungs, liver, bones, or even sometimes brain also. So this happens once the cancer cell disseminates into the bloodstream. So the important feature here is it has a capacity to multiply at the expense of other tissues, and also it has a capacity to get into the bloodstream. What causes cancer? So there are many reasons why cancers occur, but it is very difficult to pinpoint as to why a particular individual has got cancer. To pinpoint a specific reason, many times it becomes very difficult. So some of the established factors which cause cancer, I think the most important of that we will be stressing about today is the tobacco. So tobacco, I think it's an industry. It is the most common cause for cancer. Most of the 1/3 of the cancers are related to tobacco in one way or the other. But there are other factors like exposure to radiation, ultraviolet radiations, and dyes and chemicals, exposures at industry level. These are the other factors. We'll touch upon the other factors like genetic in my coming slides. Let's focus on the tobacco-related cancers, because as I said that nearly 30-35% of the cancers are in one way or the other related to tobacco. This constitutes a majority, both in males as well as in females. This is it's a burning issue, tobacco-related cancers. So we all know tobacco is an epidemic. Tobacco consumes almost 5 million deaths, and then about 1.4 million are actually because of cancer. And after that, if you look at 850,000 are actually due to lung cancer. So if you look at this, projections are going to increase, and then the number of deaths related to tobacco is going to increase. Before even we think of cancer, there are other impacts of tobacco on the cardiovascular system, be it elevated blood pressure, that is hypertension, or heart attacks, myocardial infarction, or even stroke. These are all directly related to tobacco smoking. So other than tobacco, there are some viruses which cause cancer. Some of them are named viruses like hepatitis B, hepatitis C, and the well-known human immunodeficiency virus called the HIV, and then the human papilloma virus HPV, which is responsible for the cervical cancer. Here, hepatitis B and C virus, they cause terminal liver disease called cirrhosis, and eventually it culminates in liver cancer. If you look at the scenario, what is the current scenario of cancer? I think it's one of the leading cause of most deaths. In India, every year, an estimated about 1.5 to 2 million cancer patients at any given point of time. About 0.8 million, that's about 8 lakh new cases are detected every year and added to this pool. So on top of it, 5.5 lakh cases, the cancer patients actually die every year. So this figure is continuously increasing, and that is a cause for major concern. There's the number of cases which are steadily increasing both in the urban as well as the rural population. There is a trend shift in women, females, breast cancer being now the significant health problem. It used to be cervical cancer, but in most population-based registries today, breast cancer is one of the leading causes, one of the leading cancers in women. Whereas in men, the head and neck cancers and lung cancers are much more prevalent. The male population, prostate cancer is also a very common cancer. So who can get cancer? So no age is actually spared from cancer, right from newborn to the elderly people in their 80s and 90s. They are all at risk. It's only that the risk varies with each passing decade. So right from the young, so this cartoon depicts that most of us are at risk. Nobody is immune to cancer. And it's just that depending upon the age group, the risk of cancer varies. So if you look at the 0 to 14-year age group, which constitutes roughly around 35% of the population, naturally understood that this age group has a less chance of getting cancer, only 4%. As the age increases, the incidence of cancer increases. So it peaks between 35 to 64, where most of the cancers are seen, and then again it drops after 65. Nevertheless, it continues to be high in the later part of 6th and 7th decade. So it is very important to note that 70% of the cancers, they are seen between the 20 to 65, 20 to 70 age group. So the first question which comes whenever cancer is diagnosed is, why me? Why me? And many a times the patients, first time they ask in the first consultation that I am a teetotaler, I follow a healthy lifestyle. Why me? Why have I got cancer? Many times this is a very difficult question to answer when they ask why me. But to explain and diffuse the situation, we normally explain the patient in a way. We say that the controllable factors, if you look at, there are 3 major factors which can cause cancer. I would put it as 1/3, 1/3, and 1/3. 1/3 of them are by and large related to diet, lifestyle factors, and 1/3 is environment, and 1/3 you can put it as genetic. So, so the air we breathe and the water we drink, the food we eat, there's hardly anything we can do about these factors. and you don't have any control over what kind of what kind of genetics you're going to receive from your parents and grandparents. The only thing which is controllable, which we see in about a third of case, is the diet and lifestyle. So we will look into these things. So these are the major controllables we have. What we eat and what kind of lifestyle we follow kind of determines our risk of cancer, keeping the genetic factor away. So these are some of the warning signals for cancer. I think many of us know. I'm just reiterating this fact once again. There are standard 7 warning signals which are displayed in many places. Change in bowel habits, a sore that does not heal, unusual bleeding, thickening or lump in breast, indigestion or difficult to swallow, and then skin change, obvious change in the water, mole, and nagging cough or hoarseness of voice. So any persisting symptom is always a concern, and that has to be immediately attended by a trained doctor to decide whether that person is dealing with cancer or not. So this is a cartoon which shows the warning signs or warning symptoms which is suggestive of cancer. Sometimes you can make it on a telephonic discussion, the hoarseness of voice, and change in bowel habits. Constipation alternating with diarrhea is one of the symptoms. An abnormal bleeding, you're coughing out blood, or you're passing blood in the stool. These are some of the symptoms. Aging is one of the important risk factors. As one ages, the risk for cancer increases. And as I said, family history. So family history is an important point, which is responsible in 10 to 15% of cancer. We think that family history is a major factor. No, but it only contributes in about 15% of cancers. Breast and ovarian cancers, which running in the family is the most studied genetic cancer, but that's just the tip of iceberg. There are many other cancers which run in families. So if you look at cancer prevention, many of them can actually be prevented. I've given a rough figure of 2/3, maybe a little bit. This figure is a little high, but about 1/3 to half of them are definitely preventable. If one follows these basic, simple things like avoiding tobacco, avoiding or limiting alcohol consumption, eating in the right way, that is, eating adequate fruits and vegetables, knowing one's family history of cancer, and one should be aware of the carcinogens which one might get exposed at workplaces, especially the dyes and the radiation exposure and some chemicals like asbestos. So if one can give some importance to these things, many of the cancers can be prevented. So this cartoon, are you able to see?
No, sir. Just now the sharing screen.
Wait. I'll come back.
Sure.
You're able to see now?
Yes, sir. We can see now. Thank you.
So this cartoon says eat right. This is the right way to eat your food. Your daily consumption should have lots of fruits and vegetables. I think that's the message which should go clearly. We should be careful about what we eat on a daily basis, on a regular basis. We should eat right, and a major part of our diet should have a lot of fruits and vegetables. Easy to say, but difficult to follow. But 30 minutes of exercise in whatever form goes a long way. This could be appropriate to the age and the physical condition. I think it's not necessary that everybody has to run. Some sort of physical activity which can some basic exercise appropriate for the age and the need. I know most of the people beyond 60 and 65 have a lot of knee-related issues, and they have issues to not just preventing cancer, but many other lifestyle-related diseases. So, as I pointed out, choosing a healthy food is very, very important. It reduces cancer risk by a huge margin. The most important risk factor which is established for causing cancer is consuming red meat, that is, and then processed meats, and then salted fish and other forms of salted food. These are all proven dietary formulations which increases the risk of especially colorectal cancers and stomach cancer, and some of the rare cancers like nasopharyngeal cancers. So eating a proper diet is very, very important. As I said, regular exercising around 30 minutes, maintaining a healthy weight. It is not a single day process or a fortnight process or a process which is going to last for a month. This should be an everyday routine which should go on for a very long time. That's when you actually see the results of these efforts. So there is something which is under our control. We should all get vaccinated. There are few cancers which can be prevented by vaccination. Two of them prominent is the hepatitis B virus. There is vaccine available. I think it's now part of the immunization program. And an important message for all the young girls, parents of who have young girls, they have to get their young girls vaccinated between 9 and 14 years with cervical cancer vaccine, which is basically a HPV vaccine. So this can be extended up till 26 years. Sometimes it can be given up to 30 or 35 years, but the right age to give this vaccine is between 9 to 15 years. So young girls have to get vaccinated. So it reduces the risk of cervical cancer by a factor of almost 80 to 90%. So we have a feeling that most of the cancers can be screened, which is wrong. Cancers cannot be screened. Only few cancers can be screened and made a meaningful. You can get a meaningful result out of it. So I'll name those cancers which can be screened. Many of us feel that, okay, I can go and get an X-ray and ultrasound scan or do some regular blood tests, and I'll be sure that I do not have cancer. No, it doesn't work like that. So you can have a scan or a test now. Things can change in the next 3 months, 3 to 6 months. Only probably 3 or 4 cancers which can be effectively screened on a large population basis. This is basically cervical cancer, the breast cancer, colon and the rectal cancer, and then prostate cancer. So these are the few cancers which can be considered as a screening test, but all other tests are not yet proven as a standard screening test. Mammogram, we all know it's an established screening test for detecting breast cancers at an early stage. So once a year, all women should undergo mammogram. There's a debate whether it has to be 40 years or 50 years. So nevertheless, anywhere between 40 to 50 years, one has to get started with screening for breast cancer with the mammogram once a year. Mammogram, in the simplest language, it means X-ray of the breast. This is how a mammogram is taken. An X-ray picture of the breast. Both breasts are usually taken, and this is how a mammogram looks like. This is a normal screening mammogram. So a Pap Smear is basically a screening tool to detect cervical cancer in an early stage. It is a brush which is taken from the cervix. It is a cytological examination. You can see that in the cartoon, a slide is being prepared, and these will be looked for any abnormal cells which can suggest that there is a possibility of cervical cancer. So this is a very effective test. Generally, Pap smears are done after the age of 20 years, could be done up till 60, 65 years. Should continue once in 3 years. As long as the patient is healthy, this can be continued after 65 years, or if you have 3 consecutive Pap smears, which are normal, you can discuss with your gynecologist whether you can stop the Pap smear. But it is important to start early at about 20 years and then continue at least, say, 50 to at least 60 to 65 years. So once you have a symptom which is suggestive or suspicious of cancer, then a battery of tests are done to confirm the diagnosis and take it forward. Generally, it starts with a fine needle aspiration. It's called an FNAC or a biopsy. Sometimes you do endoscopies, colonoscopies, basic radiological investigations like X-ray, ultrasound scan, and then CT scans, MRI, as the case. It depends on the case. And then today we have a single imaging tool, single imaging modality in cancer to detect as a single scan to detect cancers at various parts of the body. This is now freely available, and it's an important tool which is used at diagnosis and even at follow-up to detect reoccurrences of cancer. So I just want to close up my slides with some myths and misconceptions about cancer. So many of them, they feel cancer is a death sentence, which is not true. Many times there are patients who have gone through the treatment process and then they have come out successfully. So these success rates are increasing with every passing day now. So it is not a death sentence, definitely. And many believe that if I ignore the symptoms, they will go away. Definitely, it will not go away. It is bound to increase with time, and many times it is painless. So the elderly gentleman in the cartoon so feels that pain is an early sign of cancer. In fact, when there is pain, it's actually a delayed sign. So most of the cancers are painless in the initial stages. So some of the other myths is cancer is communicable disease. So many of there will be one member in the family who is suffering from cancer, and then the other members of the family come and ask, so we have a small child, and is it okay to let the child play with the grandfather or grandmother or whosoever is affected? Or they ask the question, the grandfather, if the affected person coughs and shares the eating plate or whatever it is, many of them feel that this is communicable. This is all a myth. So cancer doesn't spread from one person to another person in that fashion. So many of them also feel that all cancers are hereditary, which is not true. Only about 15% of cancers are hereditary. Majority, 80 to 85%, are sporadic in nature. That means you get it by chance. So for that, there will be multiple combination factors, as I said, diet, lifestyle, environment. So these could be the other various factors. Only in about 15% of cases, it could be hereditary in nature. There's a myth about sugar and cancer that eating sugar feeds the cancer cell. This is again a myth. There's nothing like sugars feeding the cancer cell. But it is very sensible to limit sugary foods as part of an overall healthy diet and to avoid putting on weight. But it is far from truth saying that sugary food specifically feeds cancer cells. Again, there's a myth that acidic diets cause cancer. There's no good evidence to prove that diet can manipulate the whole body pH or that it can impact on cancer. So these are all some of the myths. There is a huge this thing on vitamin B17 and cancer. These are considered as superfoods. So many of them they think that they have very high cure potential with vitamin B6. These are all of questionable efficacy. They have not been proven. So again, this is another thing which should not be relied upon as a treatment for cancer. So once it is diagnosed, there are basically three forms of treatment. One is a surgical procedure, and then radiation. The third one is chemotherapy. So there are some advances. I'll just close on with a couple of slides on this. There is robotic surgery now today. These are minimal access surgeries where the hospital admissions are less and the recoveries are fast. There's a lot of improvement in the radiotherapy techniques, which is, to name a few, it's called IMRT, 3D CRT, and tomotherapies. The major development is happening in the field of medical oncology with the advent of targeted therapy and immunotherapy. So this is making treatment much more simpler. Many of the times, treatment could be as simple as an outpatient pill. And immune therapies are a novel form of treatment for cancer, wherein the body's immune system is potentiated against the cancer. These do not have the side effects of traditional chemotherapy like hair fall, vomiting, fatigue, and other side effects. These immune therapies are very effective in lung cancer, renal cancer, some say skin cancer. This is becoming one important treatment in the field of oncology. So there is a lot happening in the field of oncology, especially with the advent of newer therapies. The access to care is becoming difficult. It is not an affordable treatment, especially the targeted and immune therapy. Also, some of the radiation techniques, advanced radiation techniques, are also not affordable to many. So it is a multi-pronged approach that there should be. There is a lot of support from the government today to make cancer care much more accessible. Today we have all the curative therapies accessible to even the poorest of the lot. So I guess that is those days are gone, that a patient with a curative therapy will be denied therapy. Yes, patient on a palliative therapy may not get all that which is an advanced therapy, but patients in whom a cure is always there, those patients are definitely not denied. Somehow there are government and other NGOs which are supporting many of these patients, and we are making sure that all of them get the right treatment, especially the curative treatment, which is very, very important. On top of it, I feel the most important thing is one has to be aware of this disease called cancer, and one should be aware of one's own risk, and we should follow the right diet and the lifestyle, and we should keep away from the agents, cancer-causing agents. Most important, which I said, was tobacco. So I thank you all for a patient hearing. So I would be happy to take questions from the floor.
Thank you, Doctor.
Yes.
Can I just raise one point, Doctor? I am Zambunathan. We have been talking about this HPV vaccination, and you said that up to 16 years it is okay. Can you just describe whether it's a single dose vaccination or how many times it has to be taken, and what is the duration, and what is the cost involved, Doctor?
So the idea is like this: young girls are to be vaccinated between 9 to 15 years, 9 to 16, I told. It generally required 2 doses given after a month. After a month's gap, 2 doses are required for children. But as the age increases, suppose it is after 20 years or after 25 years, probably that person will require probably more than 2 doses. They may require even 3 doses. I think the cost-wise, I think each dose they cost around 2,000, 2,500, something like that. Yeah. So it is better to give early. So you can 2 doses are sufficient. But as the age increases, probably you will need an additional 3rd dose.
This is easily available at all places, doctor, or
it's available, easily available. Yeah.
Easily available. Thank you, doctor. That solves my problem. And how about this Pap smear, doctor? Is it necessary that all should take this Pap smear?
Yeah, all women or girls more than 20 years, so they have to undergo Pap smear once in 3 years. So it is important that they undergo this test once in 3 years. So the risk increases as they enter the later part of the 2nd decade and 3rd decade. So that is where it has to be more vigorous. And then the risk drops after 40s and 50s, it drops a little bit. But you can continue to do the Pap smear until about higher limit at about 65 years. But if you have 3 Pap smears negative, you can discuss with your gynecologist to stop the screening. But all women who have started active sexual life, that's the point when they have to actually start the Pap smear. So this cervical cancer is a virus-based cancer. So this human papillomavirus is introduced only after they get into after they become sexually active.
Thanks, doctor. So nice session. I thank you for that. It's a nice session. Thank you, doctor. Thanks, doctor.
Doctor has explained about vegetables, fruits to prevent this cancer problem. Can you explain elaborately which fruits and which vegetables is more useful to prevent? Thank you, doctor.
That is a specific question, but there is nothing like if this particular vegetable or a fruit. Majority of your diet should consist of fruits and vegetables. So a significant portion of your daily diet should have fruits and vegetables. But this is nothing like this particular vegetable has a higher chance to reduce the cancer risk. So it's not like that. So the idea is you should be aware of which are those which are at high risk, especially if you are on a mixed diet. So you know that you should avoid red meat and then processed meat and then salted fish and there are other forms. So these are at high risk. So you avoid these and include vegetables fruits and vegetables in a significant portion every day, without getting worried about the type of fruits and vegetables.
Sir, Jayashree has raised her hand. Can you unmute yourself and ask a question, Jayashree ma'am? Or Aquino? Dr. Mahesh has some questions. He has put it in the chat box. He can unmute himself and he can ask some questions too. Dr. Mahesh from Rajasthan.
This the question about?
Yes,
box.
Yeah. Yes, yeah.
Role of vitamin C in prevention of cancer. How much per day does it prevent esophageal cancer? Okay, Dr. Mahesh's question is on the vitamin C and prevention of cancer. So again, it's not a kind of a proven thing that these supplements will it reduce cancer? No, I'm not entirely convinced about the fact about these vitamin preparations reducing cancer. So there is some data on vitamin C and vitamin D in prostate cancer, but that is also not proven. But this is not definitive.
Dr. Murli, thank you very much for a wonderful session on cancer. I am at present enrolled in a course run by cancer exercise experts, which is run by the president of the course is Andrea B.S. Leonard. And she's, when we are talking about a lot of cancers are there, she says that exercise is very important. As you also said, 30-minute exercise for everyone in life is important for lifestyle. But is exercise helpful in prevention of lymphedema or any other posture of the body, or even psychologically it helps the patients before and after the surgery to make up their mental status? Is there any special exercise for cancer patients, survivors, and those who are about to go for surgery?
There is no specific exercise as you are looking at. I'll try to see if I can answer one by one. You asked about lymphedema and exercise.
Yes.
Yes, lymphedema is usually seen after following breast cancer surgeries. Normally, you see the affected limb gets swollen. So yes, shoulder exercises become very important for this, and particular exercises to improve the circulation in that particular arm. They even do some massages so that the circulation in that arm, the lymph circulation in that arm improves. So shoulder exercises are important as far as lymphedema, especially after breast cancer surgery. So the idea is keeping physically active is more important. It doesn't matter what you do. I think you are looking at the specifics as to what type of exercise has to be done. I pointed out that not everybody will be able to do all the exercises which I described. There are limitations. Some people will have a lot of limitations, physical limitations. So whatever is possible in whichever form, definitely that will go a long way in improving the outcomes. Regarding these post-operative and pre-operative exercises, I think we will best leave it to the physiotherapy. Generally, there will be physiotherapists involved in the post-operative care. I think they will be the specific prescriptions will be given by them for a quick recovery. Yeah.
So just one more question. The breast cancer patients, what will you suggest to them for overcoming the stigma of scars on their breast after the operation?
So there are surgeries which can be done with minimal scar, or the scar can be hidden such a way that the scars are not seen. There are techniques. I think one has to discuss with the surgeon. Scar becomes an important point. He has to discuss and then get that one sorted out. Once a scar is formed, then there's hardly anything we can do about it. With time, it kind of reduces, but it will not disappear. But I don't think so. There is any stigma with that. I mean, many people today have come out successfully undergoing surgery successful surgery for breast cancer. So definitely it's not a
I recently on 4th of Feb, I lost one of my friend with breast cancer. She survived for quite some time, but even after target therapy, she succumbed to cancer on this 4th of Feb. And my husband is a cancer survivor. He has got laryngotomy, totally larynx removed. That's why I have enrolled in the exercise. Maybe I will come write to you in your email if you can share what all I am learning. And they talk about a lot of exercises, and a lot of people are doing that course. So maybe I will share it with
Excellent.
you.
Would be happy to know that. Very nice to know that your husband is a cancer survivor. I think nothing is. I can speak for hours together. If a cancer survivor comes out and speaks, nothing like that. So please reach out to more people.
I am doing that, sir.
Yes, please reach out.
I counsel them. Yes.
One patient, 10 doctors talking is equal to one patient talking who's gone through the process.
So he is a neck breather and he has got prosthesis. So talking is difficult for him, but still maybe one of anytime you have another program, I will ask him to talk about it.
Thank you.
Thank you, sir. Thank you very much for answering all the questions related to exercise. Thanks a lot, sir.
Good evening, doctor.
Sir.
Yes.
Good evening. Sir, I want to know if the cancer is going to repeat again.
Your voice is not heard properly, Bharti.
Yeah, I got the question.
Okay.
The question is, will the cancer reoccur back? Yeah. So these, so as I said, there are various cancers: breast cancers, lung cancer, then you have colon, rectal, stomach, head and neck cancer. So each cancer has got its own reoccurrence rates. So definitely there is a chance that the disease might reoccur. So it differs. It depends upon the type of cancer we are dealing with. So the reoccurrence rates may be less for breast cancer or other cancers like lymphoma, testicular cancers, but it could be a little bit high for cancers like the lung, stomach cancers. So these are some of the cancers where the reoccurrence rates may be a little high.
Thank you, doctor.
Mala, she has got a question.
Good evening, sir. This cancer awareness.
Evening.
Hello, am I audible? Yeah, this cancer
Yes,
awareness
yes.
program is really very enriching for us. Sir, I just would like to ask you, people with family history of cancer, what are the measures they need to take? Is there any preventive measure?
So I briefly told in my slides there are two major things which are under our control. One is the diet and then the lifestyle. So we have discussed about diet, following exercise, healthy diet. That is a very, very important part, which is part of prevention. Second thing is one should be aware of the genetic risk, which I was discussing. So there are various cancers which have increased genetic risk. We are not, science as of now has not studied all of the cancers in the entirety. But for few cancers like breast and ovarian cancers, we have very effective tests to determine the genetic risk. So if you have a particular cancer like the breast and ovarian cancer running in the family, so that confers an increased risk. So there are tests now available. They are called the BRCA1 and 2 tests. They are called the BRCA gene tests. You can do those tests and understand the risk of cancer. So I would say that 90% of the time, most of the things which can be controlled is the diet and lifestyle. Only in 10% of the cases, the focus should be on the genetic risk.
Okay. Thank you, sir. Thank you.
So in one of the slides, you showed that the sun or the radiation is also the cause of the cancer. Like, how is that, sir?
Yeah, ultraviolet. There are harmful ultraviolet radiations.
Meaning to say that we are not supposed to step out in the sun in the mid of
Yes.
the day.
So the people do sunbathing. So that is not a culture in our thing. So prolonged exposure definitely increases the risk, and this is more predominant in the ozone deficient areas, mostly the Australian subcontinent. There we see more of these skin cancers. This is a particular type of skin cancer called melanomas. So these are seen more in those subcontinents. It's not much of our problem, but it is definitely there. So the Australian subcontinent and some of the Western population.
And also these dyes and chemicals. Is the air dye also one of it? What?
No, I'm not talking about those.
Okay.
These are commercial dyes.
And chemicals, yeah. Anyone else? Yeah.
Yeah. Hello. Good evening. So actually, I have a question related to my mom. So she's actually she has undergone breast cancer treatment. She was at the 3rd stage, and she was undergoing the treatment since September 2020. So now she has completed her 13 cycles of chemo, but post that she could not go for the radiation as her body was not able to accept it. And the doctor has put her on the Fempro medication and calcium for 5 years. But after the paclitaxel dose, her like she's suffering with constant leg pain and numbness, and she cannot feel anything in the feet. So is there anything, doctor, any alternative that can be suggested to her for that?
How old is she?
I beg your pardon?
How old is she?
Her age is 58 years, doctor.
She's diabetic?
No, she's not diabetic.
So one of the drugs which is used in breast cancer, as you rightly pointed out, paclitaxel, so it has a tendency to cause a problem called neuropathy. Okay. Yes. So with time it will improve. With time it will improve.
Okay.
So you don't have to worry much about it. And, do not chase the problem with more medication. With time it subsides. Give some more time. It will not come back to complete normalcy. At least 90 to 95% normalcy will be restored.
Okay, doctor. And doctor, now she's taking Fempro, so that like because of that also she's facing certain kind of kind of mood swings and the pain in the body. So like, is that advisable to continue with such a medication?
Absolutely. The risk, the benefits what you get out of the medication is much higher than the minor side effects what you see. At any cost, you should not be stopping this medication. It's a very important medication.
Right, doctor. Thank you. Thank you so much.
Is there anyone who want to has got any queries to the doctor, or can we end this?
Shall we just one question? Shall I raise, Ma?
Yes, sir. Yes, sir. Please.
Doctor, thank you for an excellent session. It was very informative, and I mean our awareness level has definitely gone up. See, there are two parts to my question, doctor. First part is that you said that 24% of the population above 65 can get cancer. See, what are all the kinds, because most of the people here who attend this program are in this category. What are all the special risks that these people are facing and how to avoid it? And number two is non-diabetic neuropathy. Does it amount to cancer, doctor? These two questions are my questions, doctor.
Second question is easier to answer. I'll answer that first. So non-diabetic neuropathy is not a concern for cancer. Okay. Let's go to the first question. So what you asked precisely, in my slide, I showed that over the 65 age, there is a considerable risk for cancer. So precisely, I think I have put on 24 or 25% as the risk.
Yeah, 24%.
There are some cancers which are much more common with increasing age. So to name a few, I'll just randomly name a few. Prostate cancer is one such, which is quite common at that age group. So this can be simply screened by a blood test called PSA. It's called prostate specific antigen. This has to be done once a year for all those who are beyond 50 to 55 years of age group. So if you find that these values are abnormal, and if the values are suspicious, then you do further tests to either confirm the presence or absence of prostate cancer. This is one. Second one is the colon and the rectal cancers they're at a higher risk. So there are some simple tests called stool occult blood tests. You test for any blood in the stool, and then if you find that it is positive, then you do further tests called either colonoscopy or a sigmoidoscopy, then to confirm or rule out the presence of colon and rectal cancer. So colon cancers, rectal cancers, lymphomas, and then sometimes lung cancer. So these are all some of the cancers which are seen much more commoner as one ages. So what I want to give a message right now here is diet and lifestyle, exercise, very, very important. As long as you are active and your body permits, you should continue to do it. And then you understand that not all cancers can be screened. Even at the age of 65 to 70, one or two cancers can be screened. You get enrolled in one of those screening, you discuss with your family physician and screen only one of those, few of those cancers. But the majority lies in diet and lifestyle. You continue to follow that. That is very, very important. Be physically active. So that goes along. Yeah.
Thank you, doctor. That answers my questions. Thank you.
Radha ma'am wants to know whether mammography or till what age one needs to get mammography.
Mammogram you start at the age of 40, or there are some guidelines say about 50 also. So roughly we'll settle down at around 45 to 50 you start. Continue to do as long as the patient is healthy. Like me, what is the end result of doing a screening mammogram? You detect something which is a tiny lump, very early stage disease. So is that person fit for surgery? If the person is fit for surgery, that means the person should undergo anesthesia and removal of the lump. If that patient is fit enough to undergo this kind of a surgery, till such point the patient should undergo mammogram as a screening. So as a rough guideline, you can keep it 65 to 70 years. Okay, you start it between 40 to 45 and then 65 to 70, thinking that they will be fit enough to undergo, even if you detect something on the mammogram, that person is fit enough to undergo the procedure after you detect something on the mammogram.
Ramavani has got a question asking why cancer is always diagnosed at third stage.
Exactly, this awareness is for that only. So you need to be aware of which are those symptoms which are warning signs, warning symptoms, then which are those cancers. Not all cancers can be screened. We discussed only a handful of cancers can be screened. So you need to be aware that which are those cancers which can be screened and which are the symptoms where you need to meet the doctor at the earliest. So awareness is the most important thing. What people are lacking is the awareness. I also can see that Ramani has put a question, what is the percentage of hereditary? I think I answered this question. About 10 to 15% of cancers are hereditary.
Savita Raj has raised her hand. Ma'am, can you please unmute yourself and ask?
Good evening, sir. Hello.
Yeah, we can hear
Yes,
you.
yes, I can hear it. Please go ahead.
Yeah, good evening, sir.
Good evening.
Sir, my question is, I have heard that I have two questions, sir. A simple question. I have heard that consuming fresh wheat grass juice can be reduced the risk of cancer spread and cures it later. I have heard, sir. Whether it is true or sir, true or false, sir.
So I have put in the myths, many of the myths like sugar and acidic food, vitamin B17. Wheatgrass juice also comes under this. I don't think so there is any harm, but there are no concrete studies to prove that it reduces the risk of cancer. But many of them do follow. They come back and they ask whether we can give this. The normal suggestion what we give is at least they're not harmful, but it is not proven. Yes.
And my second question is, sir, are there any methods that for chemotherapy the hair shall not be removed, sir? Because many kids they are crying, sir.
What is the question? Can you repeat?
Are there any methods that for chemotherapy the hair shall not be removed, sir?
So basically, what you're asking is there any treatment in
Yes,
cancer where the hairs do not fall? Correct?
yes,
Hope I've
yes,
got it.
sir. Yes, sir.
I think there are many treatments, many such treatments where hairs do not fall. Uh, there are equal number of cancers which requires treatment where the hairs fall. That's the unfortunate part also. So it depends on the type of cancer. So there are specific medications for specific type of cancer. Suppose if it's a chemotherapy for breast cancer, hair fall is almost unavoidable. But if it's a treatment for a colon or a rectal cancer, sometimes hairs do not fall. It depends on the type of medications what we use. Some medications cause profound hair fall, and some almost they do not. And many of the newer treatments that we use for novel treatments, targeted immune therapies, they do not have this side effect of hair fall.
Are they readily available, sir? This immune treatment or radiotherapy?
All treatment which is available as global standards. All the treatment is available in India, in Bangalore. So there is. It's only that there should be the patient should have the right report and the right candidate for all these treatments. Some of the treatments are very expensive also.
Thank you very much, sir.
One number.
So, if you have time, can you talk a little about immunotherapy?
So basically, why cancer finds its the same cancer behaves in a different way in five different individuals. So it'll be the same, virtually same type of cancer. So immune system, the body's immune system plays a very important role in trying to counter the cancer cells right from formation to the spread of the disease. So the cancer cells will find a way to avoid the immune system so that they can multiply and spread. So immune therapies are generally used to potentiate the body's immune system against the cancer cells. So what would have happened is the cancer cells would have bypassed the body's immune system and continued to grow. So these are medications which are given externally to boost the body immune system against the cancer cells. So it's a very effective in certain cancers like lung cancers, skin cancers, kidney cancers. Not a treatment prescription for all the patients. There are specific patients with specific reports whom this treatment works very well. Yeah. You have to unmute.
Is the hand. and it's a number.
Hi, Dr. Good evening. It was a wonderful talk. My question is, what are the most prevalent type of cancers in India? And is it true that each city or each geography has different types? And what is specific or the most common cancers that we see in Bangalore or in Karnataka?
Oh, this is a very specific question. So, yeah, if you look at the cancer in males and females are different. As I told, breast cancer is the most common in women, and cervix is the second most common. Then the head and neck, and then the uterus and the ovarian cancer. It goes in that order. In males, head and neck as a region is the most common. Then lung, then the esophagus and gastric. The specific question which the gentleman has asked is there any geographic specific cancers? Does it vary from one place to another? Absolutely, it varies. If you look at Bangalore as an area, for us, our problem is stomach cancers. We see more stomach cancers than any other area, like Bangalore and Chennai. This area we see a lot of stomach cancers. So some of the places, like if you go down south further, Kerala, Trivandrum, thyroid cancers are their problem. If you go up north in the Ganga belt, gallbladder cancers are their problems. So likewise, each area has its own problems. Cancers are very specific. But if you look at Northeast as an area, you find the highest incidence of cancers in India in Northeast. So all other areas you compare in India, Northeast has the highest incidence of cancers. I hope that answers your question.
Yes, doctor. Thanks for it.
Any last questions? Because we are already running out of time for today's session. Anybody would like to ask any last questions, or we can wind up today's session? Okay. So Shakuntala ma'am, you can give the conclusion speech.
Yeah. Thank you, doctor, for a very detailed, informative session about cancer, its features, prevention, and your patients answering to all the queries of the participants. On behalf of Vayomanasa Sanjeevani and all the participants here, I thank you wholeheartedly for this session, sir. Thanks again.
Thank you very much. I thank the organizers for giving the opportunity. Excellent participation. That's what is most important. So I could see the very nice participation, very nice interaction. Thank you very much once again.
So with that, we would like to conclude today's session. I would like to thank all the participants who have joined for today's session, and especially our resource person, Dr. Murli Subramanian sir, for having that wonderful speech, and that informative presentation was really helpful for all of us. With that, I would like to thank all the participants who have joined, Shakuntala ma'am, sir, and our partners for Vayomanasa Sanjeevani, Government of Karnataka, Samadhana Counseling Center, Icon Life Science, REC Foundation, NSC Foundation, Bangalore Apartment Federation, Indian Psychiatric Society, Karnataka, Chapter 1, Karnataka State Legal Service Authority. With that, I would like to wish all a wonderful evening. Thank you.
Thank you. Thank you, Gina. Thank you for this opportunity.